Good morning, everyone. As all of you know that National Institute of Social Defense is the nodal training and research institute in the field of social defense. So social defense covers the entire gamut of activities and programs for the protection of society. It is currently focusing on the human resource development in the areas of drug abuse prevention, welfare of senior citizens, pedigree prevention, and other social defense issues. NISD has recently launched an online learning management platform, Tapas, and is offering 5 self-paced online learning certificate courses in the key areas of social defense. There is also NR57. We have started with the online. Today's topic of our discussion is falls in elderly causes and preventive measures. And the source person for today's session, Dr. Anand. Request everyone please mute their mics. Sir is Professor of Medicine at BLDE, DU, Shri B.M. Patil Medical College Hospital and Research Center, Vijaypura, Karnataka, and established the geriatric clinic in the year 2007. Sir is also recipient of State Award 2016 from Government of Karnataka for Best Geriatric Services. He is also a fellow of ICP, GSI, Royal College of Physicians, Edinburgh, and Scholar of Commonwealth Commission, UK, for MSc in Dementia from University of Stirling, Scotland. He has 75 publications and 3 fellowships to his credit, is on editorial board of various journals, and has authored 2 books as co-editor and associate editor. He is also providing consultancy services to NPH, Tata, Tangle Trust, MPH, Course, BAU, BA, Instituting Geriatric Society of India, Prevent Elder Abuse, and Group for Education and Research in Geriatrics. He also has orations, 20 awareness talk for seniors, and 20 health check camps he has arranged so far. So it is a pleasure as well as an honor to welcome Ambali sir amongst all of us. And sir, it is all yours. So kindly go ahead with your session without wasting in your time and our participant time. We can go ahead with our session. At the end, there are interactions. So whatever questions you have, you can please you unmute and ask questions. Registration form I already sharing in the chat box. Please go ahead with registering yourself for this, and you may also kind of the so that we can keep on increasing. Will your feedback are most important for us so that we can working on it. I understand webinars for everyone. Thank you, sir, and please your session, sir.
Thank you very much, Asha Madam, for those kind words of introduction. And it's a privilege to be a part of National Institute of Social Defense and being a part of faculty. This is the second time in this year. I'm really privileged, and thank you for giving me this opportunity. I think I will do justice for your call. And at outset, I convey my sincere thanks to the Director, Sir, Dr. Virendra Mishra, Sir, and Deputy Director, Dr. Sridhar Reddy, and also my sincere gratitude to you for having me on this program. And today we are going to discuss a very important topic, that is falls in older people. I am restricting my discussion to only the causes and how best we can prevent, because falls as such is a huge topic which cannot be covered in 45 or 60 minutes. I think I'm audible clearly for all of you. Am I audible, madam? Clearly?
Yes, it is.
Okay, thank you. So this falls in elderly causes and preventive measures we will discuss hereafter. I bring greetings to you from Shri B.M. Patil Medical College Hospital and Research Center, the geriatric clinic. We have also adopted a village where we provide health services, and of course from home care. The unique feature of our geriatric clinic is, apart from health services to the older people, we conduct awareness camps. We have a dementia clinic. We also have an exclusively immunization clinic for senior citizens. So with this background, I like to convey all the audience here that I shall be talking in a very simple English. And second is I am aware that the participants are the mixed here, from the professionals to the caregivers. So in that context, I will share the details about falls in older people. What is a fall? What fall means? What is the impact? Why we should discuss about fall in elderly people? What causes fall so that we can prevent them? How to do an immediate management if you a person, a caregiver in old age home sees a person falls, what he can do? Or if we see a person fall on the roadside, what we can do? And how to prevent falls not only in home but also in all the workplace. And the most deadest place for the older person to fall is again in a hospital. So how best we can make our environment friendly, fall free friendly for the older people. So in this context, I will discuss under these headings. We will share in both. So I just requested all of you to put your questions so that I can discuss. Now is a challenge. Fall, when an older person falls, it is a challenge for whole the family. Whether he falls in the home or in the hospital or in the old age home or in the garden. I hope all of you agree. Wherever he falls, it is a problem for us. Now, the old person, when he falls, he may just get up and pretends nothing has happened, and he goes home, clearing here, and he won't inform anybody. So this fall is unreported. It goes unreported because he has not developed any injuries. And sometimes the older people are so smart that if they have some scratches because of fall or the hands and all, they wear full shirts. They start wearing full shirts in the home, and even come to the clinic, so that we should not notice it. The children should not notice that there is an injury. This is what the older people does if he doesn't develop any major consequences of a fall. It must be just a small injury, but once a fall, we need to evaluate. As a clinician, we must ask all the patients above 60 years, whenever they came, did you had a fall in the last week, in the last 6 months, in the last 1 year? It's a very important question, because older person himself never reveals. The moment the old man says that I had a fall in the morning in the garden when I was working, बेटा बोलेगा पिताजी कल से बाहर नहीं जाना है, बस घर में रहना है. So this is the another negative impact for the older person. That's why they hide, because they want to do the routine activities that keeps them active. So that is where we have, as a physician, as a caregiver, and all of us who are providing care to the older person, we must keep asking them, did you had a fall in last one? Just in a conversation, not directly go and ask. While talking some things, you just ask, when was the last thing you fell? And he may open up laughingly, or he may open up, and that you have to notice. So why it is challenge? Because fall can lead to bedridden of the old man. Suppose a 80-year-old man gets a fractured neck femur, and he has multiple comorbidities, and due to some reason surgery cannot be done, so he will become bedridden throughout his life. This is the biggest challenge for caregivers, for family members, and the person himself. Financial issues are there, because one hip replacement surgery or hip repair surgery in any corporate hospital, any hospital for that matter, it turns into lakhs. So are the persons ready to have these financial implications? Loss of independence. It's very important. The person, the moment he falls, he feels that he is losing the independence. When we tell the old man in our clinic that you are having giddiness, you are likely to fall. Why don't you use a stick? He says, oh, why stick? I am still active. I am still young. So that concept, because what is in our mind is he should not fall. He should use a stick, walking aid. So they feel that it's loss of independence, and sometimes it leads to loss of independence as well. There are plenty of caregiver issues. When the older persons are staying, even if the children's, grandchildren's, all are working now. So if a person occupies a bed in the corner of the home, there is a lot of pressure on the caregivers. How to manage a old person, who to manage. Motivation is the most important thing for both the patient who had fall, person had fall, also for the caregivers. If the son or a daughter-in-law is strong enough to say, जो होगा करेंगे हम, चलो ऑपरेशन करेंगे, हम आपको फिजियोथेरेपी दिलाएंगे, हम रिहेबिलिटेशन करेंगे, आपको हमको देखना है कि आप 3 महीने के बाद चलते रहेंगे. If this is a motivation among the caregivers, yes, definitely the outcome of the fall-related injuries will be very, very good. Equally, the old man or old person should also have self-motivation. Yes, I want to remain independent. I don't want to depend on others. If he has that self-motivation, definitely this challenge can be overcome. Multiple comorbidities, yes, as we grow old, a disease goes on adding. At the age of 60, diabetes, at 65, myocardial infarction, 70, hypertension, 75, stroke, osteoarthritis, anemia, so many conditions, they are additive. They go on adding. And by the time an 85-year-old person fall, he has at least 5 comorbid conditions, and he will be at least on 8 to 10 medications. This is a very important thing we should all know. Delirium. Yes, the moment he fall, he is in a state of confusion. What happened? I don't know what happened. Why this happened? Suddenly I fell. I had a blackout. I don't know what happened. So he is in the state of confusion for minutes to hours. And when you approach him, आपका नाम क्या है? आप कहाँ से है? कहाँ रहते हैं? He will not be in the state of mind. He will be in the state of confusion. That is another challenge. And these older persons, when they are in state of confusion, following fall, maybe because of the pain, or now they have got all the negative thinkings that oh अभी तो फ्रैक्चर हो गया, सर्जरी होगा कि नहीं पता नहीं, सक्सेसफुल होगा कि पता नहीं, मैं चल सकता हूँ कि नहीं पता नहीं. He has his own concepts in the mind. And pre-operative assessment for the older person for delirium is very, very important as a clinician, because we see n number of cases being refused by private practitioners, and they land up in our institute because he has developed delirium in the hospital. First day he was all right, second day he started talking irrelevant, third day patient is confusion, aap kaun hai, kahan hu. Then they refer to the higher institute where we come across, and most of the time they are alcohol withdrawals also. The old man has drunk under the influence of alcohol, he had a fall, he had injuries, and when he comes to the hospital he cannot drink, so he'll end up in alcohol withdrawal. So that creates again more problem instead of confusion when management. This is another challenge. And neglect, self-neglect by the older people and neglect by the caregivers. It is possible. So the older person who had a fall, inoperable state, remains neglected in the home. He may not be provided adequate food. He may not be provided adequate water and the care, bath, dressing, combing, all those things he may not be provided. So these are the challenges. So what we should know as fall has a multiple causes. It has multiple risk factors, and to treat, we need teamwork. We need a team approach. A alone physician, alone surgeon cannot do. There should be an equal involvement from the person himself who had fall. He should be willing to get things done. Caregiver should be ready to support him, apart from the health system, physiotherapy, rehabilitation, and the nursing care. All these comes under team approach. So fall is very important for an older person. If he doesn't develop any injuries, he just gets up and walks, it's well and good, but the chance that he will fall again remains. These are the various challenges a old person who had fall will face, his family members will face, and the health system will face. So collectively, we have to work for the betterment of the patient, keeping one goal in the mind: improve his quality of life. In whatever state he is there, improve his quality of life. And second is no to ageism. अरे अभी इतना 80 साल का हो गया, ऑपरेशन कैसा करेंगे, ये इसका क्या होगा? No. If a good clinician is there, he will assess him and tells that कोशिश करेंगे, he can walk. चल भी सकते हैं, 3 महीने लगेंगे, 6 महीने लगेंगे, लेकिन at least he will be independent to at least to attend to the daily needs or nature's call. Now, what is the important falls? We will these are the lot of statistics all of you can go through. What is important is falls are very common in middle and low income countries. Of course, they are there in even best of the hospitals, 5-star hospitals, 7-star hospitals in USA as well. But they are also common in the community in middle and low income countries like us. And 60 and above, they are more prone for fall. Maybe an external condition or intrinsic factor, whatever the reason we'll discuss. And if 40% of the admissions in the hospital are because of falls related in an elderly population. So why we should discuss this? It can be prevented. There should be a preventive strategies to emphasize. That's what this NIST is taken this huge step, because through this we are educating a mass how to prevent a fall. If fall happens, what to do, how to improve the quality of life. This is what today's discussion is meant for. Training and creating a safer environment. Yes, we are the part of that. And prioritize the fall related research. One of our colleague who is also a participant here, Dr. Mahesh, was telling about this. How can we do a research and start involving many consultants and create an falls prevention research academy? So yes, there are scope. There is a lot of scope. And ultimately, as a clinician, as a caregiver, as a son of an or a grandson of an 80-year-old person, it's all our responsibility to ensure we prevent a fall. What we can do, we'll discuss. I'll just share some scenarios how the patients with fall comes. We had one 70-year-old lady. She had a fall, fracture neck of femur on the right side. She was admitted in the private setup. There for 15 days, despite of treatment, there was no control of blood pressure. So again, they brought to our geriatric clinic. We controlled her blood pressure over 1 week. It took almost 1 week to control blood pressure, subjected her for surgery. She was very strong by willpower. She was even thin and lean, and she was very strong. So she underwent surgery successfully. On the 8th day of surgery, post-surgery, she went home, started walking in the home with a walker. And what happened? That boosted her confidence. So despite being told not to work, not to exert much, again, her hobby was to read the books. So after 10-15 days, she went home, she started reading the books, and the books are kept at the high level of the shelf. So one day morning, she went to remove the one book from the shelf from the height of what she could not attain, and she had another fall. So she had a fracture on the other side. This time, she was not willing for that surgery, and despite having good willpower. So she remained in home for next 3 months, and she succumbed to this second injury, which otherwise could have been prevented. This old man had come to my clinic and with a fever, history of fever, cough, and breathlessness. And I, after my clinical examination, all I found that there was a catheter coming out in between the legs, and it was a condom catheter. And I asked, why is that you do this? Then his family members said that he has incontinence. He gets up more times in the night. So every day 8:30 we put the condom catheter, and morning 8:30 we remove whatever urine he passes. It passes in the bag. We throw it and wash it and keep another. Then I was astonished. What is this? What is this you're doing? How can you do? This is a risk factor. And later I told them, you can still go for a diaper, or you can keep one bucket by the side of the cot. Third day after saying this, what happened? The next third day in the morning, somebody rang his, it was a routine for him, rang the bell in his home, and this old man was in hurry to go and open the door. And without the knowledge that he has a catheter down, he went fast to open the door, and he toppled and fell. And he had a grave head injury, and he succumbed to it. He was in coma for 2 days. This was a preventable fall, despite we telling the family members are reluctant to attend. So again, we had a problem preventing a fall. So these are the case reports. They are truth, what is happening. Now, why I'm telling? Because all of us should know, whether you are working in the old age home, or as a nursing staff, or or you are a caregiver of your own grandparents or parents who are above 60 years. The commonest, this is a case 3, site for fall in home is a bathroom. Early morning 4 a.m. to 6 a.m. when the old man goes to the bathroom for pee and or for passing the stools, he strains for the stools, he had a constipation, and when he get up, he had a syncope and he falls. 4:30 in the morning he falls. 6 o'clock when the daughter-in-law wakes up and sees that, oh, the old man has fallen in the bathroom, he is rushed through ambulance to the orthopedic ward. And when we took the ECG, it revealed an acute heart attack, acute myocardial infarction. So what I like to convey here is in fall is a one condition where in older people above 70 or 80 years, it can be manifestation of an heart attack. It can be a manifestation of a pneumonia, high degree fever, urinary tract infection. So many conditions can produce fall. Syncope can produce fall. So this gentleman had an heart attack in the morning, 4:30 a.m. He had asymptomatic, he didn't never complain of chest pain, because of which he had a fall, and because of which he developed a fracture neck femur. 6:30 he was noticed he had a fall. 8 o'clock he was brought to the institute. 9 o'clock he developed complications like heart failure. That is where we entered into the scenario. So a fall is due to heart attack and come with many complications. So always when you see an old man with a fall, don't only concentrate at the site of injury. You have to look at what else, why it is caused. Some initially the older person reluctant, नहीं कुछ नहीं हुआ, कुछ नहीं, ऐसे कुछ बीच में आ गया तो मैं गिर गया. We always try to know, चक्कर आया था क्या, कुछ चक्कर आया, कुछ खाए थे कि नहीं, शक्कर की गोली लिए, खाए कि नहीं, शक्कर कम हो गया, पसीना छूटा था क्या. So all these things we must keep asking to know the cause for his fall. The first fall, never ignore, keep digging. So this patient had fall because of heart attack, and he also developed complications before he came to the hospital, because he had to again lie down in the cold bathroom, flooded water for 2 hours before family members could notice. Fourth case is a person who have been taking a long time painkiller and steroids. So very common. It's common in older population. I hope most of the practitioners here agree with this. Diclofenac sodium is taken for osteoarthritis knee, and steroids are taken for COPD, chronic lung disease, as also for the osteoarthritis. So he came to us with a history of fall. And I am just showing you the 2 drug strips. One is the Dexona, that is dexamethasone, and another drug. Okay, so what was happening was he had, this is the diclofenac sodium, he had a severe knee joint pain. You can see the branding marks. उसको गरम रॉड से जलाए भी गया था. This is a common thing we do. They practice, quacks practice here. They put hot rod of irons, garam rod, lal iron rod, they place it in such a way, and they say that the pain receptors will die and the pain will reduce. No, it doesn't happen. So what happened when he came to us with a fall? When we took the X-ray, he already had an fall 2 years back. He has got operated. Now again he had developed another fall. It was not an huge fall कि impact क्या ऐसा हो कि उसका fracture होना चाहिए. Just a simple fall, a tip बोलते हैं. उतने पे भी उसको fracture हो गया, दूसरा fracture. another fracture. So the person who is taking these painkillers, steroids for a long time, they will have weak bones. Bones will be deprived of calcium. Bones will be deprived of vitamin D. And what will happen? They are prone to develop injuries, even if the slightest fall, even if slightest injury है, कुछ ऐसा लग भी गया तो bone fracture हो जाएंगे. More than that, he also had anemia. He also had a renal failure. So all these are the challenges. An old man comes to the hospital when he fall. So this is what I was telling you. Now we do a home visit when we are called to attend a old man who had a fall. Yes, only a couple staying, husband and wife, late in 70s and 80s, and the neighbor called us. So गिर गए, जब आके देख लीजिए. When we went to his home, he had already was lying on the floor, and he was pulled from the bathroom and put on the floor with the clothes. And on examination, what we found, his right leg was looking smaller than the left leg. Okay, and this suggests, all of us should know, all of you just look at it. You don't have to be a doctor for this. Older man, when he falls, unable to get up, complaining of severe pain at the site, where the fracture site, and if he is right, whichever limb is short and it is reverted, I'll show the photograph, that says there's a fracture. And in such conditions, we should not be hurried to shift him on the cot and all, because we will create more problem. Call an ambulance, and with the proper stretcher and the help of the paramedical workers, then only you shift him to the hospital. So this is how we come across scenarios in our day-to-day practice, in geriatric practice. And for here, all of us are responsible to take care. I might have shifted him to hospital, then surgeons does, then again the role of physiotherapy, role of rehabilitation, role of nursing, role of family members again sets in. So it is combined effect of the all of us to make the person again back to track. So what we define, a fall is an unexpected event in which a participant comes to the rest on the ground or the lower floor. Okay, sometimes older people say abhi बुड्ढे हो गए हैं, अभी तो ताकत नहीं है तो गिरेंगे ही. No, that is not true. That is not at all true. Whether you are old, you are 90 years old, 100 years old, it's not the rule that you should fall. There is some reason you have fall, means there is some reason that you have fallen. So falls leads to morbidity, the fear, depression, loneliness, social isolation, to the death. And most of the older people, they don't report fall. We, the clinician, we dig it. I'll not tell your son, I'll not tell your daughter-in-law whether he had a fall, because I had to do other evaluation. Why did he fall? And as I told you, 40% of the hospital admissions of this because of the falls across. Now, after, not only the longer bones, even the spine bone. This is the X-ray of the bone, that is spine, the spinal cord. So when the older person fall with like sitting, ऐसे गचक के बोलते हैं ना, तो गचक के बैठ गए, तो they have a fracture in the spine. This creates a lot of pain and reduced activity, and he is advised again bed rest for next 3 weeks. So imagine how the quality of life will be there. A lot of pain, immobility, being bedridden. So what happens when the person falls? In majority, nothing happens. They just get up. कुछ नहीं हुआ, चलो ठीक है. Either specs broken up or some खराश आ गई, चलो. Some will have fracture of the radial bone, that is called Poly's fracture. Vertebral fractures, this is very important. Vertebral fracture, this reduced to the height will be reduced, continuous, they'll be having pain. Again, for that they'll be taking high dose painkillers, and again it will end up in many renal problems and the heart problems. Femur bone, the thigh mein rehta hai, uska femur bone, that can also go for fracture, and some will have a severe head injury. And any person comes with a head injury, please don't ignore. Please don't ignore, because in the older people, even slightest injury can cause bleeding inside. So at least a bare minimum CT scan of the brain should be done within 24 hours of the fall to rule out any damage to the brain. Where the old person can fall? जहां भी बुजुर्ग जाते हैं वो कहीं भी दे कैन फॉल, कहीं भी दे कैन गिर जा सकते हैं, घर पे ही, इवन इन द बाथरूम, इवन इन द किचन, इन द डाइनिंग रूम, डिपेंड्स अपॉन garden. Yes, if the old person is fond of gardening, they can fall in the garden. Hospital, yes, hospital is also an risk factor for a person to fall, because a lot of things are there in the hospital, tiles, cleaning, shining, and a lot of saline stand, instruments in and around, so that will create shock. Old age home, yes, they can fall anywhere. Wherever the old man goes, he is likely to fall. So it can be anywhere, just anywhere he goes, he can likely to fall. Maybe because of the environmental factors, or because of the issues that he has in his health issue. Now again, I was telling about impact. So why we should talk about fall? क्यों बात करनी है? Fall, गुजर गिरते हैं, उठते हैं, चलते हैं? No, there it decreases the quality of life. It's very important. The moment they fall today, it takes for them for 1 week to 10 days to come out of that concept कि मैं गिर गया था, तो अब मुझे क्या होगा, मैं और गिरूंगा क्या? These are the concepts that they will be having. Fear of another fall. I may fall again, so I will stop going for the morning walk. I will stop doing gardening. So they stop working in the favorite things that they used to do. Social isolation. अरे मैं उधर गया और गिर गया तो. So they stop avoiding meeting their friends, going to the marriages or all the ceremonies they wanted to do. Injury related pain is very bad. Sometimes it remains, and especially in the cold days or winter days of October, November, December, January, this pain will be there, persisting, and sometimes intolerable. They become confused, they become agitation because of severe pain. And another effect is inoperable. The person may not get operated. So that there is another problem that person can have. And the older person can be bedridden, can be a bedridden throughout his life. So this is an impact of falls on the older people. So is there a problem with my voice? The function and the quality of life deteriorates drastically after fall. That's very important, we should know. And 50% of the older people who are in military before they had a fracture do not recover to the previous level of mobility. He was riding the scooter earlier, now he had a fall, surgery, but he cannot ride the scooter now. So this is what the statement. He will be devoid of what he was doing, what were his hobbies. He was earlier walking, go for a dance. Now he should stop, because 50% of the older people following surgery of the hip, they will not go back to their normal routine. And again, I was telling you, they had a fear of falling again and lose confidence. And they avoid going, meeting friends, shopping, cleaning, because of fear. And this leads to being bedridden or getting themselves isolated in the home. That leads to loneliness, depression. If they don't move around, again they become bedridden and stiffness of the joints. So in a nutshell, it leads to a social withdrawal. They have fear, मैं और गिर जाऊंगा. So another fall, loss of confidence, and the patient have independence. Admission to hospital, he has to undergo surgery, he may not undergo surgery, surgery may be successful, unsuccessful, he remains bedridden. And that all leads to depression, anxiety, loneliness, not only in the person who had a fall, but also in the family and the caregivers that are there. So which are the common bones that are involved? When a young lady falls, she falls like this. Okay, and when the old lady falls, she falls like this. So the chances that the vertebral body, that spine or a hip fractures, are common in the older people, because the impact is on the hip bone here or on the spine bone. So I showed you the photograph of how the vertebral body fractures and also the hip bone fractures. So this is how the old person, when they fall, they try to fall on the back and they sit out. Younger generations fall. There's a very common fractures out of the hand. Okay. Now, how to predict? After knowing what is a fall, what causes fall, how to approach the fall. Now, how to predict? कौन गिर सकता है? So the best predictor for a risk of fall is a history of fall. If an old man comes and tells you, I had a fall last week, he is bound to have falls again and again. We should try to know what is the cause for it. It may be simple early cataract, early blindness. It may be a vertigo, hearing problem that has led to a fall. But we have to evaluate and find the cause to the serious problem like heart attack or a fever. Okay. So second thing, giddiness on change of posture. मैं बहुत देर बैठता हूँ, उठते ही मुझे चक्कर आती है, बहुत देर सोता हूँ, उठ के बैठते ही चक्कर आता है. So this is an warning sign that he may likely to be fall. So here we should consult a doctor. He will do recording of blood pressure both in sitting and standing position. If there is any change, he will definitely let you know. Okay. And recently we were discussing one case where the old man used to have giddiness after full meals. So it was a post-meal hypotension, orthostatic hypotension, because post-meal heavy meals he used to take and he used to feel giddy. So that is another reason in the older person. And always try to look at the older person when he's getting up from the chair. If you have a chair with the both sides handle, if he is holding and putting a lot of pressure and getting up from the chair, he is likely to fall. If he is not taking the support of the side raise and getting up directly on the chair, he is less likely to fall. These are the simple observations all of us can do on our older parents. If he is taking a lot of support on the side of the chairs and is trying to get up, yes, he is likely to fall. Okay, so he tells, the moment I get up from the bed or after sitting, I pray, I do offer puja for hours together, and the moment I get up, I feel giddy. From the commode, I get up, I feel giddy. There is a problem. He is likely to fall in the bathroom. Now, some medical conditions, I was telling you, which leads to fall. It can be heart attack, it can be pneumonia, urinary tract infection. So all that can lead to fall. Even a stroke that can lead to fall. Now, who are at the risk? Or not all older people will fall, but these are the people who are at risk. Those who have got Parkinson's disease, those who have got Alzheimer's disease, bilateral severe osteoarthritis, blindness, still we come across people. Those who are taking sleeping pills, they are likely to fall in the early morning. Very common. It is scientifically proven beyond doubt. Okay. And those who snore in the night, they are also likely to fall because they have interrupted sleep in the night, and in the morning they won't be fresh to have and a day to begin. Those who consume alcohol, unsteady gait because of previous injuries or previous surgeries, those who have hearing problem with the, connected to the ear problems, they are likely to fall. Incontinence. Every hour the person has to go to pass urine. Urinary incontinence, it may be because of prostate enlargement, or he may be taking some drugs. They are likely to fall. Slippery fall. Sometimes the cleaner is there in her home and she has spilled some water, forgot to clean it. The old man can slip on that. Bright light, very important. Lot of light nowadays. The home, newly constructed homes have got very huge LED lights. In a one room of 10 by 10, they put 6 lights, and that is more problematic than helping the person. Okay, and if the old man or the lady is standing for the long time, now they meet a friend, after a long time they keep talking for hours together, half an hour, 45 minutes, 1 hour, and they keep standing and talking, and once they turn up, baat ho gayi to gir gaye. So in most of the marriages where I attend, or the functions where the older people are celebrating their anniversaries, I keep telling them, you now please sit, don't wait for a long time, don't stand for a long time. That will create more problem for you. Now sit for some time, because standing for a long time in a same position and then you take a sudden turn, you are likely to fall. These are the risk factors for the fall. Now, if the old man is staying in the first floor, most of the time it may be in the old age home or in his own home, the old persons are likely to fall when they are getting down. They can climb up easily, but when they are coming down, they are likely to fall. This is very important, one must know. So always emphasize this and allow the person to climb, but when they want to come down, either by the ramp or by the escalator, so that has to be followed. And nowadays our young generations are tied with the wires for laptop charge, mobile charge, everything. Wherever there is a plug, they start charging. older people are not aware of these things, so they just move around, and these are the nowadays common causes for fall in homes because of the lot of wires and coming. Chappal, some of these loose slippers, older persons, they don't want to change whatever they're having. Okay, the slippers purchased 5 years back, the spectacles purchased 5 years back, I still want to use because I'm attached to that, they keep telling. So the loose slippers can lead to fall. If the older person is using bifocal lens, these are the greatest risk factor for fall. It is always, I recommend, get two different specs, one for near and one for the far if you are using. So that is very, very important because this leads to fall. It has been scientifically proved. Okay. Polypharmacy. If the person is taking more than 3 drugs, of course, if it is really required for 5 diseases, okay, but if they are interacting with one-to-one, it is again a role of physician. A geriatrician has to come here and say that these drugs are not required, only these are required. This combination is causing problem to you. Polypharmacy has many issues, itself is a topic, can cause falls. Constipation. The older person squats for the long time, 30 minutes, 45 minutes to evacuate stools, and the moment he gets up, he feels giddy and he may fall in the bathroom. So all these issues are very, very important. So what you can do in your old age home or as a clinician or a general practitioner, you can just make the patient walk in your clinic. Tell him to, this is a description, tell him to get up from the chair, okay, walk around for 10 feet and come back and sit. So if make him to walk 10 feet, turn around and come back. If the patient takes 20 seconds to take a turn and come back and sit, he is normal. If it takes more than 20 seconds to do this, it is abnormal. He is likely to fall. This is what I was telling you. He gets up, walk around 10 feet, come back within 20 seconds. Okay. And that is what the marking you should be there in your clinic as well. The another test you can simple do is 1 foot balance test. Stand with a for more than if you can stand on 1 feet for more than 20 seconds, you are less likely to fall. But this should not be done in all the older persons, and those who are frail, you should never do this because they'll definitely fall. But those who are above 60 and you want to do assessment, if they had a fall even once, you can go ahead. But those who are very, very old, you please try to avoid these tests making them stand. Now, what to do when the older person falls? We all can be, hum sab iske we can have a look. We in front of us, most of the older people fall, or we are called when the person has fallen. So look for alertness. Is the old person alert? बात करो, चाचा जी क्या हो गया, कैसा हो गया? If he is alert, पानी चाहिए, कुछ लेना चाहेंगे? Alert, yes, fine. Or unconscious, it's an emergency. Sweating, देख लो पूरा अंग पर पसीना आ गया है क्या? पसीना आया है तो yes, it can be because of low sugar. Low sugar, sugar की गोली रात को खाई है लेकिन खाना नहीं खाया. Low sugar, hypoglycemia and he had a fall. Heart attack, sweating can be because of heart attack also. उसके उनको जीभ का देखिए, उनके जीभ निकालने को बोलिए, जीभ पे भी अगर कुछ खून का दगे हैं, टंग बाइट, इट सजेस्ट ऑफ हेमाटाइटिस and epilepsy, but that we not consider the fall, but that is a different issue scientifically. But for an discussion for our audience, this can do. Shortening of the lower limb, I was telling you, the moment अब देखो one leg is short and elevated outside, there is a fracture. Head injury, look at the head injury. If there are any injuries, bleeding, just put a pressure and stop. This is a role of all of us, whether we are working in a hospital or in old age home or in our own home, or when we are called to examine a patient at the home. Now ask the patient, छाती में दर्द है क्या? Did you have a chest pain? If he says yes, then well, it looks like it may be a heart attack. Okay, tell him to move all the limbs. If he is able to move all the 4 limbs, less likely he has a fracture. If he says, I cannot move right limb, I cannot move right shoulder, I cannot lift, so there is an injury, there is a pain, there is an injury, there may be a fracture. Okay, so then don't force him to. Now at least by asking him, you will come to know which part you should not touch, because that will produce pain. Okay, ask dard hai, so if he tells, if there is a pain, he will definitely tell. What is our role? We should be calm. This is very, very important. कोई बुजुर्ग गिर गए तो देखते ही अरे पहले ही बता दिया था, अरे तुमको बोला था, नहीं गिरना था, ये लेना नहीं था, वो करना नहीं था. No. Be calm yourself. Try to be calm yourself. Settle the issue. Do not shout. Do not blame at that time. Immediately do an arrange for ambulance. That is very, very important rather than blame them. वो बात में भी हम कर सकते हैं. So at the time of injury, at the time of fall, you don't know when he had fallen, how did he fall, and we need an emergency care for that patient to rush him to the hospital in the ambulance. This is the photograph I was telling you. If a person is lying down on the bed and there's a fracture of the bone, what will happen? The right leg will be deviated outside and it is a smaller compared to the left side. So it suggests that there's a fracture. Why we should know? Why a common man should know? Because shifting him from the floor to the bed or to the ambulance is very, very critical in these cases, and paramedics are well trained for that, so they will come and do the assistance. Now, this is an education for all of us. If an old man had fallen and if he is alone, what he can do? So he can try to move around, thoda halu sarka ke wherever there's a pain, avoid, and try to catch or grab a chair or a cot or a stool, whatever is available in the very recent one. Try to hold it, get up and sit. This he can do as shown in the photograph. So he moves around, try to kneel around, try to lift and put his pressure and sit in the chair and give a call or call your friends. When there is a person to help, when you are there to help, what you can do, you can bring two chairs. First ask him, where is the pain? How did you fall? Okay, fine. We will arrange to make him remove from that place to the safe place. That is very, very important. And put the two chairs. So try to move him towards one chair, take the support of one chair, let him get up and simultaneously pull the another chair towards the back and let him sit on this chair. This is the safest method of shifting the persons who had a fall in the home, either when they are alone or if you are the witness for this fall. Don't get panic and don't start blaming. Be calm. What should I do? What should I do? How can best I can shift him from this place to the stretcher or the safe place? That is what we should think. This is a very good picture. Is released by Singapore Hospital, and I am showing you here. Now, coming to fall detectors, how to identify this person had fall? Yes, our own Indian system had mentioned that there is a fall detection system. You place it in all your home, whenever the old person falls, the message goes to the Microsoft Office, to the Bluetooth, it goes to the son's mobile and to the center in the this control room, and from there it generates a message and sends to the mobile phone of the son, and the mobile gets alerted. So that is how the things happen, right? Second is digital technology has come with a sensor. The advantage of this is it has no camera. It will only sense whether you have fallen. So it has no camera. It can be placed anywhere in the bathroom and bedroom. Your private life is not compromised. It requires 24-hour Wi-Fi and it requires it's just $250. So whoever can afford can put it their home. Now third thing is sensors. Most of the people say wear sensor. Whenever you fall, you click, press the button. See what happens when the old person fall. He himself is in panic. He doesn't know what to do, and now in that he has to search. कि मेरा sensor किधर है, मैं button दबाऊं. All these are little problematic, but still it can be used in the older people. So as a clinician or as a parent, son of the grandfather or grandson, you can see that if the older person is giddiness, he is losing his balance, till the medical condition is improved, at least tell him to use the stick. Now the sticks are available in various colors and designs. Now coming to the last part, how to prevent injuries, maybe in the hospital or maybe in the home or the old age home. What we practice in our hospital is we put the cushion bed by the side of the cot in the night hours. So if the person even if falls, he will fall on the cushion and not develop any injuries. Rail should be only half. There should not be a full rail cot. This is very, very problematic. Half rail, this is advantage that they can hold it, even try to catch it while getting up. And if you put the full rail cot, what will happen in the sleep? They feel that they're in home and they try to climb through the rails and start getting down, and they will definitely fall. So always go for the 1/3 rail of the cot. That is very, very important. The restroom should be senior friendly. They should have a grab bars everywhere. Wherever they get up, they should have a grab bars. Even in the tub, if they are using their toilet, they are using the grab bars are very, very important, because the moment they get up, they may feel giddy, they may lose balance, so they can hold it properly. And if the person who is having to pass urine frequently in the night, you can tell them to use the bucket. This is what I advise in for my patients, to keep a bucket by the side of the cot. Every night he can pee in the bucket, keep in the bedside and sleep. Next day morning you can clean it, or you can even use, these are available, bedside commodes are available. So tell the patient to drink less water after 9 p.m. Whatever quota of water he has to drink before 9 p.m. Diapers are the better options nowadays. A lot of people are using, even in the villages I have seen many older people are using diapers, that they have found it benefit, and get the sugar level and prostate level enlarged if they have got the problem. Now these rails are very important. Always try to see that such floors are avoided even in your home, because they are not only shining, even the slippage of water, if floor is wet, cannot be seen by the older people, and they are likely to fall. Now hip protectors are available in the market. So hip protectors are there, you can use it over the underclothes, and you can play it, and even if you fall, that protects the fracture. As one of our colleagues told, that the airbags are available. Now this is available, right? But the utility is very, very low. Older people doesn't want to use these things. Earlier there was, now also we see a lot of older people refuse diapers. So many people are even refusing these uh, hip protectors. Now exercise, we tell the patient just walking is the best exercise, and walking is the best exercise that can improve a lot of muscle strength, and it improves the well-being. So walking is the best exercise. The older person should keep doing walking, because it puts all the muscles in action and it improves the strength of the bone. So exercise of anything which is feasible for them, giving the medical conditions in them. Osteoarthritis is there, and we cannot tell them go and do a cycling. So whatever best they can do in exercise, in the modalities, in the form of yoga, meditation, that is for the mental, and these exercises which helps grow the muscle strength and the bones. Even if they're interested in dancing, let them dance in the home for some time every day. Give them a privacy, so that improves, that itself improves the strength and the coordination. This is very important. This improves the coordination of whole body and prevents a fall. So identify and remove the potential hazards in your home, like clutter, I told you, the wires, and modify the employer to improve the mobility and safety. Put the grab bars, raise toilet seats, and very important, whether it's the hospital or the home, old age home or your own home, always look for the spilled liquids on the floor. You may be having grandchildren, he might have peed, or he must have spilled some water. That is very, very important. Otherwise, the old man can fall at any given time. What we do in our hospital, this is my own hospital, we have a full length grab bars throughout my hospital. The moment they enter, till even to the restroom, they can go and come back and move around with the grab bars surrounding. So they feel it's comfort that they are moving around with the support. And in the staircase, if you are having in the home, it's inevitable for the old man to stay in the top floor. Always put the colors for the first step and the last step, and even the grab bar should be color coded or colored, so that the old man comes to know that there is a grab bar and he can hold. The most important thing is, all of us should practice in our home. If you have got older people, always keep the lights on in the bathroom. It's very, very important. Every night the light should be on in the bathroom. Daytime you can off, but night it should be on, because that helps the older person to avoid fall. And avoid skid use anti-skid tiles, and such matters are very good in preventing or slipping in the bathroom. Now we should always tell them not to keep the items that are required very high, the height. It should be kept at an easily accessible height, so that again they will not fall. Okay, so and nowadays the socks are also available with anti-skid, they can use, and because they will avoid falls. Floors, if you have a carpet edges torn, they can also lead to fall. So a senior friendly OPD or the hospital is also mandatory, like a ramp and the rails and a short, very small height cots will make the patient very comfortable. Regarding nutrition and lifestyle, of course, they should stop smoking, taking alcohol, and being obese and the sedentary lifestyle. They should go for the sunlight, exposure to sunlight, especially in the morning. Have a good meals rich in calcium, vitamin D, and they should keep moving. Now, if they have health issues like an cataract, get it operated. If there is a change in blood pressure, meet a consultant immediately and take the treatment. If the person is falling recurrently, definitely he needs an evaluation in depth by a physician or geriatrician. Nutritional concerns should be addressed in all the older person who had a fall, even before fall. And any change in behavior, if the old man is avoiding going to meet friends, if he's avoiding telling, no, I don't want to go, something like he's avoid, his behavior changes are there, then definitely we have to assess him for the fall. For all the youngsters here, lift feet and live fit. This is what the message I like to give. Lift, don't take the escalators wherever you are. Lift fit, go for the stairs and live fit. So in old age home, all the protocols are there by the government of India, NISD division. Anti-skid ties should be given. Adequate training for the people working in that old age home. That is what we are doing through NSID today. Rails and ramps is mandatory in all old age homes. Emergency support should be there. Yes, and we have to have one emergency cot. In the last talk, I had discussed about that. Training of the staff members in handling these people. Those posters can be posted in the old age homes so that they can help the older persons whenever new staff joins. The restroom should be adequate, big, less shining, and no anti-skid tie should be there. And anyone at the risk, they should be referred to the medical help immediately before they fall. Don't wait for them to fall. If you suspect that this old man is likely to fall or he had a minor fall, please take him to the doctor and evaluate him thoroughly. And sensor systems can be used. And as the another colleague also told, there are bags that are available. So what is the take-home message for all of us? What I feel is falls are preventable. Yes, and a fall prevention program should be oriented not only to the older people but also for the caregivers, like all of us. We are all the caregivers primarily, and falls are costly and harmful. Very, very important statement one should know. Motivation for surgery is very, very important both for the person and the family members. Reducing falls is the main goal in the our geriatric care and the support, and try to improve the quality of life in the older person. Role of physiotherapy and rehabilitation should never be ignored. They have very, very important role to play in improving the quality of life and bringing the older person to near dependence. So he has to come out of the dependence and go to the independence level. For that, physiotherapy and rehabilitation has a paramount importance, though it takes time, but it has a very, very important role to play. And I request all the people say no to ageism. अरे अभी बुढ़ा हो गया, इसको क्या करना है? नहीं करना है. There is a, we have to give them best whatever. Let why you decide. You ask him. You ask him. अभी गिर गए हो, ऑपरेशन करना है. Yes, you ask him. But you yourself don't take the decision that why should I do this and okay. So a boy falls to standing. Okay, and young falls to love, and elderly falls to fracture. With this quote, I just like to conclude. This is one of the article which we have published in the Springer Journal on prevention of falls. And I request again all the members here to join TAPAS, the online education program on geriatric and dementia care by NISD. And thank you all for your patience hearing, and I'll be open for the questions. And this cartoon is telling how motivated the old persons are. Thank you very much for patience hearing. Madam, over to you. There are no questions in the chat box. Madam, we are not able to hear. Any questions from anybody? Madam, over to you.
Thank you your valuable information. But लास्ट में मुझे तो आवाज नहीं आ रही थी आपकी, मुझे नहीं पता बाकी पार्टिसिपेंट्स को आपकी वॉइस आ रही थी कि नहीं आ रही थी. But people are writing in chat that excellent talk that Ambali sir has.
Ma'am, it was
So now the
audible.
session is okay, fine. Maybe मेरे यहाँ पे कुछ नेटवर्क का इशू हो सकता है.
We could hear, ma'am.
So, sir, more than 60 participants joined us today, and I request them to please, if they have any, if they want to ask you any question or they want to share any feedback or want to share their any experience, please unmute your mics and can go ahead.
So this is Dr. Anupama.
Yes, madam.
Yeah, in fact, while following your CME, there was one lady who is sitting here. She's a 83-year-old. She came with the complaints of giddiness and falls 3 months ago. And she had a fracture of the femoral neck. And she had a replacement, hip replacement, done very recently. But still, her son's complaint are that she has high, fluctuations in both the sugar levels. She is diabetic and hypertensive. This is being managed by a general doctor, and her polypharmacy, so there are nearly 15 medicines which she is on, including lot of things which I really am not able to explain. So I've sent her actually for an echo and just to sort out the problems, where to start and how to streamline the management. Most of the treatment, most of the things what we are seeing in our OP, sir, is because of only polypharmacy. Outside doctor is giving multiple medicines for diabetic care, insulin, lot of OHAs, including sulfonylureas and all, which are not. And BP medicines are also 3 to 4 at this age of 80 plus. So I think some awareness has to be created really regarding polypharmacies.
Yes, madam. You are right. And rightfully, you are in the right track. So you have to address the polypharmacy. It is our role. Now we cannot blame anybody. It is purely our responsibility. Yes, take them in confidence. Stop the drugs which are not at all required. Inappropriate polypharmacy. Remove the drugs which is not required straight away, and put the combination of drugs. And you are right. You are going for echo, auscultator for carotids. Okay, and also examine for ears if she has got tinnitus or vertigo like features. So I think you can do that. I know you, madam, well. So I think you can go ahead with these tests and you can give her a good quality of life. But always look for the polypharmacy, and you have the authority. You can straightway say, remove these drugs. No need, stop.
Yes.
I think we will listen to you.
Yeah, that would be better, sir, because we need to spread the awareness also to general doctors.
Yes, madam. Exactly, madam. You are right, madam.
Okay, sir. Thank you, sir.
Hello, sir. This is Monica Kankarwal from AIMS New Delhi. Sir, I'm a PhD scholar and I'm a PhD scholar in nursing science, and I'm pursuing my study on this topic only. I'm doing a program which is for prevention among elderly. It's a multifactorial program, sir. So thanks for this session, sir. And I just want to tell you that, sir, it's a multifactorial approach, and it's of course it's require multi means like every sector of people should get involved in this, from dietitians to physiotherapists to nutritionists to family caregiver, and the main role is played by the family caregiver. So I'm doing a research basically at primary level itself, sir. So thank you, sir.
That's nice, Monica, to hear from you, and I wish you a good luck. I hope this deliberation was helpful for you, and you will take it to the further level.
Sure, sure. Thank you so much, sir. Yes, definitely. I'll take it, sir.
Thank you.
So
Hello.
can we get these PowerPoints to teach others, our students?
Yeah,
Because
sure,
many
madam.
could not attend today.
Sure,
Hello.
sure. This video also be there. I think Asha madam will upload this video shortly on the NISID link, and we will share the link with you, madam.
Yeah, please, in our mail, if they can share the link, it would be useful.
Surely, they'll do it, madam. Asha
Ma'am,
madam
it
will do
will
it.
be available on the YouTube channel and also on the Facebook channel of Facebook page of NISD. So
Okay.
don't worry, it will be available there.
Okay, sure. Thank you.
Bashu Saab, you are asking some question?
Yeah, sir. Sir, I'm calling from Yadgir. Actually,
Yes.
what you have give information is very useful to us because we are working in the field. We are see so many problems in the elders. It is today's session today very useful to us. I'm very
Thank you.
thankful to you, sir.
Thank you.
Actually, I have met you last
Yes.
2 years back.
Exactly.
Actually, you are given information more about the elders. Very useful to sir. I'm very
Thank
thankful
you.
to you.
And we are also happy that you have started a geriatric clinic in your
Yeah, sir.
area. And
Sure.
I
We are,
feel happy because
yeah, sir.
I was
We
a
are
part of
working with
that clinic.
geriatric
Yes, that's
because
a great.
I'm program coordinator, geriatric program coordinator.
Very good. I'm very happy for you, and we are here to
Thank
assist
you.
you in from all the angles.
Yeah. Thank you, sir. If you have any doubts, we can call to you, sir,
Sure,
anytime.
sure. You are most welcome.
Yeah, sir. Thank you.
Thank you. Thank you.
Okay, sir.
Yes, Ashok sir.
Excuse me. Hello.
Anuradha, please.
Yes, sir. Sir, I would like to ask you one thing. Like, my father-in-law is 76 years old, and his BP always fluctuates. Like, sometimes it's low and sometimes high. Okay. And immediately after having any meals, he's scared of falling. Actually, he sits for around 15 to 20 minutes, and after that only he gets up. Like, is it I mean, वो सही में होता है, or is it because of BP or it's because of fear? We are not. I mean, we tell him he'll support you to take you to your room. He said, "No, I won't get up. I'll be here until I'm fine." So, is it fear or it is because of fluctuation of BP? And we always we don't know how to get out of from the fear of I don't know. मतलब पता नहीं क्या करना है उसमें करके.
अनुराधा, आपका प्रश्न बहुत important है. This is very important question you asked, and both the answers may be true or one of them may be true. The first thing is we don't know whether he had a fall in the past. If he पहले भी कहीं गुजर मतलब he had a fall, then he had the fear. Second important thing I was telling you is postprandial giddiness. अगर खाना खाने के बाद उनको चक्कर आता है, तो there is some issue, health issue. Okay. So, what are you doing, madam?
Ma'am, sir, I'm a housewife. Like, I only take care of him.
Fine.
उनके health issues तो as such like कुछ नहीं है. Like he hardly takes even BP tablets. भी बहुत rarely लेते हैं.
Okay,
Almost.
ऐसा कीजिए. We can do if you have got digital blood pressure apparatus in home. Okay.
Yeah, we अच्छा blood pressure. हाँ, we
Record
do.
his blood pressure before the lunch, and after 15 minutes of standing after lunch, again record the blood pressure. Make him stand for 2 minutes and record the blood pressure. And which drugs he is taking, all those matters. So consult a physician because he should not fall.
Yeah, till date he didn't, but उनको वो डर लगा रहता है आधा घंटे के बाद. Heads up. Yeah.
उनका भी सही है और आपका भी सोचना भाव 100% सही है that you have concern that he should not fall. That is a good thing. So that is a very good thing. You have concern. So take him to the doctor. Record the blood pressure pre-meals. Make him stand for 2 minutes after meals and again record the blood pressure and make him sit. If there is any difference, please consult a physician there in your place.
Sure, sir. Thank you, sir. Thank you so much, sir.
Thank you. Yes, Ashok sir.
जोखिम उठाया या जोखिम उनके लिए बेहद
Ashok sir, any questions for
ने सफलता की कई कीर्तिमान बनाई में उनकी एक और फिल्म महल जिसमें मधुबाला थी। रोमांचक फिल्म महल को भी बेहद कामयाबी मिली आज जब हिंदी सिनेमा में ललित
अशोक
देव
सर, आपकी आवाज नहीं आ रही है। आपकी टीवी की आवाज आ रही है हम लोग को।
उनका अभिनय लोग की
I think I just on. Any other suggestions? Anything where we should have been better in this discussion? This open for all the participants.
And share your experiences if you want to share. That is
Yes,
also
that is
most
most
welcome.
important. That is most important. And this platform by NISD is very fruitful, and they are so open. Thanks to the concepts and the organizers and Asha Madam and the team for giving openness to the audience, participants. Everybody is learning. Even I am learning. So all of us learn together. Any other thing anybody wants to share? Anjali Madam, do you want to share issues? Okay, most of them are looking after the old age home, and few of them are consultants, few of them are taking care. Anybody, all of us have to go to that stage. We have to take care of our older people in home. So all these things begins in our own home, and then professional. And it is very challenging, as Anupama Madam told. The older person comes and sits with a fall or the previous fall, and Anuradha is telling expected fall. So these are the challenges that we have to face. And we have solutions for everything. So we have to think out of the box, and we can find solutions for these things. Only thing we have to share. This is a platform to share. This is a platform to learn. I think it's... Thank you for the questions. And still, if you have got any questions, I think you can put it on the chat box, or you can convey to Madam. She will send the questions to me.
Thank you so much, Anand sir. It was I'm sorry, sir. I think the mic got muted by itself. So thank you so much, Anand sir. Excellent presentation, very well explained, and positive information that you shared with all of us, sir, today. On behalf of Senior Citizen Division of National Institute of Social Defense, I would like to extend my gratitude that you took time from your such a busy schedule for NISD Senior Citizen Division, and you deliver a lecture and took a session for all of us, sir. And we are also thankful to all our participants who came out and asked the questions from our resource person and make this session interactive. So we are thankful to everyone who joined us here and make this webinar a success. More than 60 participants joined us today for attending this session, sir. Thank you so much. Thank you so much, everyone, for joining us.
Thank you, Madam. Good day to all.